Um, I would love this to be participatory. I can lecture you guys on self-care, but you will all be asleep in our 45-minute allotted time period. And I quite frankly think that that's insulting and that you are unlikely to leave this session with anything you didn't come with. So my goals for our session are to talk about what is self-care and what isn't it. And I want to talk about some barriers to self-care. I want to talk about some of the things that I see in my office and patients that come in, as well as in myself and in my friends. And my hope is that we can make a list of things that we have tried that worked for self-care, and it doesn't have to be something that we're doing now, but if even one of us gets an idea of something that we feel like we can do, this will be a successful session. My hope is that each of us will leave with 1 to 3 ideas of something that we feel like we could actually do. So what self-care is thinking about what you actually need, what nourishes you, and thinking about how to meet those needs. I think all of us except Monica on this call are parents, and we're kind of hardwired, particularly as mothers, I think about what the needs are of our families. And we have to do that, frankly. But if we don't think about our own needs and attend to our own self-care, we're not going to have the resources to bring to our families that they need and we want to give them. And I can tell you from my own personal experience, I've got 3 kids. I have a private
Naked in a wet shirt?
I have a private practice,
You don't
and
have on a wet shirt.
and
Sorry.
that's no problem. And I am the medical director at North Star Reach, and I talk a lot with our counselors and our staff about self-care, and I think a lot about it myself, but I haven't always done it well. And I think the biggest mistakes that I've made in my life as both a physician and a mother are mistakes that came out of me feeling to realize what are my limitations, what do I need, and taking care of my own needs. You know, I can remember a time 10 years ago when I thought that I had to absolutely spend every waking moment attending to what my kids needed. I had one of my 3 kids who was not doing well from a mental health standpoint, and it felt literally life and death to me at the time. And I isolated myself from my friends. I stopped running. I stopped eating the healthy things that I normally eat, and I paid the price for that. And since that time, 10 or 15 years ago, I've become even more passionate about self-care, and I'm super honored to be here with you guys because I think you know what you need to do, and if we can band together and try and find something that we can do to even do a little bit better job, that'll be a gift that we can give each other. I can tell you that people, because I have not stopped working, I'm around a lot of people. I have the honor of serving a lot of people, and people are not practicing good self-care right now. I had a guy last week who came in for his physical. He's in his early 50s. He's a parent. Told me that he was drinking a drink or 2 a night, doing well, starting to exercise. Well, 2 days later, he was in the emergency room with pancreatitis and admitted that his 2 drinks a night each have 3 shots in them. You know, almost everybody that I've talked to says that they're either drinking more, eating more, or exercising less. This pandemic is another layer on top of having a child with a chronic illness that really challenges our self-care. So some of the barriers that I see regularly for self-care are, I tell my friends that I think that one of the most prevalent diseases in the United States is the victim mentality. I even find myself in this role. So like last night, one of my coworkers called me with a question at 8:45, which he told me he had for me at 8 a.m. He knows that I go to sleep at 8:30 to somewhere between 8:30 and 9. And he woke me up, and I felt so victimized by that and so angry with him, frankly, until I realized, you know what? I used to have something on my iPhone that was a do not disturb function. And I would put it on at 8:30 every night and keep it on until 5 in the morning. And the emergency room and a couple of other numbers can get through. But it protected me. But it took me probably 2 hours last night to remember I'm not a victim and I do have some control over my self-care. For me, what I talk about with my patients is the Mother Teresa principle. We need food, sleep, and a roof over our heads. Then everything else in terms of health care, self-care, medical practices comes after those three things: sleep, food, and a roof over our heads. So I think victim mentality, like we're stuck in this role, and it's, you know, there are a lot of limitations to having a child with a chronic illness. You know that better than I do. And there's a reality to that. But we get to choose how to respond to that, kind of that time period between realizing the situation we're in and realizing how we're going to respond to it. That pregnant time period is the time in which we can either choose to be a victim and just kind of, you know, go forward feeling angry and resentful about it, or make a choice that maybe can change things even the littlest way. Another barrier to self-care in my mind is the tyranny of the urgent, like getting done the stuff in front of us. Our kids have to go to school, our kids have to eat, our kids have medical needs. We got to get food on the table for our family. We have to make enough money to be able to pay our bills. And once all that gets done, sometimes it feels like there's not a lot of time left over. There may not actually be enough time in each day. That's a reality. Another reality is there's a lack of resources to support parenting kids with special needs and healthcare needs. I think particularly in this pandemic, I'm seeing a lot of a sense of hopelessness, a depression, a loss of control. And those feelings are real and they can kind of suck you down unless we take a minute and step back and say, okay, I'm feeling these things, what can I do about it? For a lot of us, we have tapes from early childhood that, or maybe a first marriage, or being bullied at school, that lead us to automatically think we're not worth it, you know, or feeling guilty. I don't feel like I can really prioritize myself. You know, this isn't a worthwhile thing to spend time and energy on. Most of even the physicians I know struggle with that. I know I do. Social isolation is a barrier to self-care. How do you get your social needs met when we're in the middle of a pandemic? How do you get your social needs met when you can't leave because you've got a kid at home, which nobody is available to care for in a way that feels safe to you? Finances are a very real limitation. You know, like, I remember reading that book, I can't think of the name, about some woman who went down to some island, love something and something else, and, you know, spent 2 or 3 months like meditating and sitting in the sun.
Love, Eat, Pray.
Yes, thank you. I hated that book. Like, seriously, if I could afford to spend 3 months on some island, you know, I would feel better too. But most of us can't do that.
Right.
So I'm sure you can add your own barriers to self-care, and I would like to talk about that and hear you guys' ideas a little bit. That being said, I want to, Monica, you can take the slides off for a second and put us back on gallery view. I would like us to do a little exercise. One thing I've learned about meetings is that it's easy to sit and like complain and talk about what we can't do, but that's rarely super beneficial. That if we can stay solution focused, I think we can all leave with something that we weren't aware we had when we joined each other 10 or 15 minutes ago. So I'm going to challenge you to do something real quick. I'm going to give you guys 1 minute to go to the room that you're in and find an object, doesn't matter what it is, that for you makes you think of good self-care for yourself, reminds you of good self-care for yourself. Doesn't matter what it is. And then I'm going to ask us each to show each other that object and say a word about it. All right, meet you back in.
Only in this room?
Well, you can go. None of us know where you go. You can,
Okay.
anywhere you can run and get back in 60 seconds. Go for it.
We're doing a scavenger hunt. Mind your business.
15 more seconds. Waiting for Nicole. She's looking, she's looking. Rosemary and Mia, if you want to join us, flip your video on. We'd love to see what you have. Or if you don't want to flip your video on, flip your mute off and tell us about it. Who wants to go first?
I can. This is Nicole. It's reading. I just grabbed a book off the shelf, but this is one of the books that I'm reading.
Oh, that's awesome. What?
Becoming Athena. So it's a leadership book. Just taking time, and that's a big that's a big thing for me, to be able to take the time and walk away from whatever else is going on for everyone else and say, I'm going to do something just for me. So yeah, so it's reading. It's not necessarily just that book, but reading in general is one of the things I try and do.
That's awesome. Thank you.
Yeah, thank you.
I'll go next. Oh, go ahead.
It's reading also, because I kind of realize that I've been forgotten, and I'm the one who forget about myself to take care of myself. The title is She's Still There. It's like I am still in there, and I'm looking for myself right now.
Oh, that's wonderful, Fabian. It's a good reminder to all of us. Thank you.
Mine is my Rosary Beads.
Mm-hmm.
It's just a nice quiet time, and whether it's meditation or prayer, or just a quiet time.
I love that, having an object to remind us to do that.
Mm-hmm.
One of my physician friends told me to remember to pray every time I pee. She knows I pee a lot.
Good one. I like that. I grabbed something too. So I have a problem with self-care when it because I feel like I always need to be productive. Something I'm working on. I'd love to be able to sit and relax like some of my other folks in my life. But so I started doing embroidery because, and I'm working on one now. It's not necessarily, I don't have a business, I don't have an actual thing I'm trying to produce, but it still feels good to do something with my hands. And then I could sit and breathe, maybe listen to music or a meditation. But doing something with my hands allows me to just like have a moment to be quiet and feel like I'm still getting something done, even if it's just because I enjoy it.
That's wonderful. A lot of times meditation is offered as a means of self-care, which is lovely. It feels not approachable to me, but I think embroidery is a kind of meditation. That feels approachable. I appreciate that. Cece?
Quiet back. I have my, it's a aromatherapy candle from Bath and Body Works, and it's love. It's my favorite scent, so it's rose, and it just helps me to relax because I really struggle with relaxing. The problem is remembering to light the candle and sit there with it, but if I do, it does help me to relax.
That's a great one. And smells for all mammals are a known way to get to our limbic system, the part of our brain that has to do with mood and relaxation. That's a great one. I love what you said too about remembering to light it. I know for me, like a simple thing that I did just this fall was to put what do you call those lighter things, sticks, near every candle and put the candles where I
Ah.
sleep. Like, well, that's easy. Thank you. I brought this, which is my four-legged hairy children at home. My children are all grown, and for me, I have two black labs, and just petting them, like that's been shown to produce endorphins, and they're just always so happy. And so that's one of the ways that I practice self-care. Thank you, guys. Rosemary or Mihai, are you there? Do you want to offer anything? Okay. I'm wondering, when you guys think about even like those specific objects or your experience, let's say in the last couple of months, I listed some kind of general barriers for self-care. Can we share with each other some of the more specific barriers to self-care? So like maybe I shared sleep interruption, you know, that is a barrier to self-care for me.
I think I just always get in my own way of that. So
Of what? Of sleep or
of
self-care?
of everything. So everything's self-care. So if it's, you know, sleep, I talk myself out of it, or I'm too busy. You know, my mental, you know, oh, I should go get a pedicure, and just, no, I got to do this instead. Or, you know, so I get in my own way of letting myself relax or do something for myself, or, you know, enjoy the moment of whatever it is I'm doing for myself.
I think that is so shared. Do you have any thoughts, or does anyone else have any thoughts on why do we do that? Like, that is an honest question. That is not here's some doctor leading a discussion group. Like, seriously, why do we do that?
Yeah. I think it's just inherent of being a caregiver, period. Like, you don't have to even care for someone else at the moment, but if you are that, if that's within you as a caregiver, you're always looking to care for someone else, not yourself. It's, you know, so you easily talk yourself out of those things.
Me, I always think that I will have time to do certain things for myself because I have an only child. I'm like, my son first, let me do this or fix the house, fix dinner, do something, and I'll take care of myself last. That's why even with my reading, I do it late when I'm like ready to go to sleep. It's like 11:30. That's when I'm gonna grab a book because that's when I'm finally done with everything else, but I don't put myself in the schedule to do something to say, okay, from 1 to 1:30, it's my time. I don't do that. I always find something else to do.
Yeah, it's that prioritization. I completely agree. In making ourselves the priority and not feeling guilty about it. I don't know why we do that.
Well, and logically, we all know that. We all say, like, if I don't care for myself, then I can't care for everyone else. But let me take care of everybody else first.
Yeah.
I also think it's partly self-preservation as a caregiver. So I'm not a parent, but I am a caregiver to other folks in my family, and so it's different. I don't pretend to know your experience, but it's, you build up an armor of I could handle it all, and then if by taking care of yourself or giving yourself the moment, it, to me, and I know it's not true, it's almost like it's showing weakness. Like I can't juggle all of these, or I'm asking for help with dinner so I could go get a pedicure. It's like, no, I could do dinner and do this and do this, but I can't. And getting the pedicure or reading or doing my embroidery is just as important. But I think that it's like an armor that I put on, that I've got it all, and I don't.
Yeah.
For me too, I think it's been a matter of family expectations as well.
Yeah.
Because if I do something, then all of a sudden it's like, well, but I need you to do this, or, you know, what do you mean you're not going to be home for dinner, or whatever the case may be. So then you feel guilty, and then it just adds on, instead of standing your ground and saying, you know what, you all get to go do your own thing every now and then, why can't I? And
I honestly think we're dealing with like an intergenerational societal unrealistic expectation of women, you know. And it that it takes a lot to change that. It takes a lot of courage. Like I think about like women's right to vote or something like that. Like I think it's bigger than that. Like, I I didn't even start to try and attack the things that you guys are identifying, and some of you are clearly like way younger than I am, until I was about 50 and my life was falling apart because didn't I could not find the courage inside myself to say I can't do this. I need help.
yeah,
Definitely. I'm 34, but 2 years ago, my life fell apart, like every aspect, because if you consider it like Jenga, everything was me, and I was the bottom block, and I had a husband at the time, and he wasn't helping. I do know now that I didn't vocalize that I needed help, but I mean, I was clearly drowning in everything that was going on. And at some point it was just like, enough is enough. I can't do it all. And I still tell, I can't do it all. Some things are not getting done. And now what I'm trying to work on is making sure that some of the things that aren't getting done are their things, because my things never got done and their things always got done. So now I'm working on trying to balance and putting me in the schedule, because it just never was. Like I had 2 babies back to back. So just showering was a rare treat. I mean, I'm not talking about a luxurious hot shower. I'm talking about washing up quick and getting back out to nurse. That was a treat. And that's scary. That's not good.
And I judging from the heads nodding, like we all know that. I remember like a month ago, I was showering and I realized I didn't even know if I'd use soap or not. Like I was so not there that I had like done the thing without even being present enough to know if I used soap.
If you did it yet.
Yeah. Like, so have you found, thinking about, I just have to say, I feel better already. I hope at least one of you guys does, just knowing that there are other people that
Yes.
struggle with what I struggle with. Be it having kids, not having kids, sick kids, not sick kids, divorced, married, whatever. There is a commonality, and just seeing you guys on this screen, I'm like, heck yes. The 8 of us could make a difference. Like with alone, I don't feel like it's hard for me to believe that I can make a difference and start to begin to prioritize, the matriarch of the family. But I think the 8 of us could. Cece, how can you share with us 1 or 2 ways that you are, like in a very practical way, learning to put yourself on the schedule?
It's a working schedule. I'm not there yet. But actually what I did, I read a book, and the book wasn't actually about self-care. It was a book about, like, I don't know, fixing your marriage. But what I took from the book, the biggest point I took from the book, was self-care. Self-care, self-care, self-care. It's all about, one of her assignments is we have to write down 3 things each day that we are going to do at the beginning of the day, for self-care. And at the end of the day, before you go to bed, you're supposed to revisit that list, and you're supposed to have checked off what you've done. So I am at the point where I do come up with my 3 things. I'm not at the point where by the end of the day I've done them, but I am identifying them. And that is a step, because before it wasn't even part of my day. I'm hopeful that maybe by the end of the year, I'll at least be getting 2 things done a day. And we have to make sure that self-care isn't chores. So it's not getting the laundry done, or, something on, you can't cheat and say that's self-care, So that's the tricky part. It actually has to be something you enjoy just for you. And
You wrote down 3 self-care things every day.
every day, I do it every morning.
Wow.
Yep. And they don't have to be big things. It's just, it's not a habit that I have, actually getting to them. It's changing our habits is probably the hardest part.
Just writing them down count as one of the
I think
things.
so. I think
Right?
so.
Because you have to identify them. You have to write them
Yes.
down. Like you took a minute to do that.
And
I
it's by
feel like that
yourself
should
and it's
be
for
one.
yourself. Yes. And I think a cup of coffee with them, technically, that's a second thing.
And to that,
Hmm.
I feel
So
like
that's,
sorry.
go ahead.
I feel like sometimes my problem is accepting help. Before, that was my biggest issue because my son was, especially when he was younger, taking narcotics. I didn't trust anybody with them. And then my family is in New York. I'm in Connecticut. It's only me in Connecticut. And I remember once I was working night shift, I would go to work on 2 hours of sleep for like 2 weeks straight. And at one point, my manager was like, "You can't keep coming to work. You got to stay home. Otherwise, you're going to crash." But the reason why it was really hard, I didn't have nobody, no one else. My husband was working, I was working, he was doing the night duty, and I was doing the day shift with them. And then when we come back on 5, go to bed for 2 hours and wake up. And like Cece said, now I'm in the middle of a divorce. Everything is chaotic. And my son is really sensitive. You're trying to protect your child, pretend to be happy, put a smile on your face. And still, everybody's in New York. And I'm stuck in Connecticut in the midst of the pandemic. But
Yeah.
even though everything is chaotic now, I feel like I found a time to take care of myself. I've been living around here for 5 years. I just started going for a walk almost every day, sometimes
That's
for an
good.
hour. You stay with your dad, I'm out. And I feel like it's been really good. I'm like, oh, I never knew that the neighborhood was so nice. I've stayed for 5 years. Now it's like my priority is take care of myself first, because if I'm not well, he's not. And I had to tell him that. I'm like, sweetie, because now he's 12. I'm like, you getting there. Certain things you can do. I can trust you with certain people now. And then because if mommy is not healthy, you're not gonna be healthy, especially emotionally.
Definitely.
I'm like, mommy needs time. You spend time with your dad. Now, that's why this weekend we're going to New York. I'm like, you're gonna spend time with your cousin. I'm gonna spend time with my cousins. We're gonna have time to have fun, and it's all about me.
Yeah. And that's okay.
Yeah,
That's the part
but it
we
was
have to
hard. Yeah, it was
know.
hard.
I also have gone through a divorce about 20 years ago, and that was another, now that I'm thinking of all these times in my life when I didn't take good care of myself.
Yeah.
But someone said to me, like, what are you teaching your children? You know, and I love what you said, Fabian, about telling your son, like, look, I have to take care of myself. I want to take care of myself. That will allow me
To better
to
care for
take care
you.
of you, do the things that are important to me. How did you give yourself permission, and how did you set it up so that you actually went out and took a walk every day?
It's looking at my son because he's an emotional person. And then sometimes he will come to me and ask me, "Mommy, are you okay? You don't look okay." And I didn't want him to see that every day.
Mhm.
And then he's a social person. I'm an introvert. I had to learn from him. And I realized when I go for the walk, I am less anxious, and then I am like calmer with them. I don't snap. And I told him that I'm like, I don't want to snap on you. Let me go for my walk. I listen to my music on my walk. And then when I come back, I'm happier. And when I first did that, I was like, oh, I feel really good. And then I kept doing it over and over. I'm like, okay, now it's my routine because I see that physically, emotionally, I feel better.
So if there are others of us, and I'm sure there's not, on this call who haven't established an exercise routine and want to, what would you tell us?
Find what works for you. Seriously, do something. Even with the reading, I tell myself, even if it's one chapter, I need to read every day. Even if it's, I don't mind if it's 10 minutes, I need to do it because it makes me a better person. That's what I'm working on, being a better mother and a better woman. Because before I was a little bit harsher, but now I feel like I'm like nicer, and that's who I want to be.
Seeing the
That
result.
that on one of your slides, it said tyranny of urgency. I think that is where I live, and I'm trying to get past that. But the same thing, always snappy. It's always, my mind's always running. I'm always busy, even if I'm like taking my bath or whatever, and I'm supposed to be relaxing. My mind is like, you have 5 minutes because you have this, that, and that. That is so real, and I wish, like, I'd never heard the term before, but I wish I knew more about it. I'm gonna certainly look into it because I think that would drastically, figuring out how to combat that would drastically improve not only my mood, my demeanor, the kids, everything would run smoother if I wasn't always like, I don't know, not nice. And it's not on purpose, but it's just always busy in my
There's
mind.
actually something we've done at camp. And so if you think of urgent and important in quadrants, so like some things are both, some things are urgent but not important, some things are not important or urgent, but they're still on your radar, and then some things are important, and making sure as you're getting things sifted toward you, and I mean, life is crazy, but camp is crazy, so you're hearing all these things like, is this something that's just urgent and I feel like I have to act on it, or is it something that's going to impact the whole day at camp? So maybe like, you know, scoring where they are, different things in your life will help you kind of suss out some of those urgent needs, seemingly urgent needs, for some that are important, like taking your bath and like enjoying it for 10 minutes.
True.
Nicole, thanks, Monica. I'd forgotten about that. You keep nodding. What are you thinking?
Just all that prioritization and scheduling your time and, you know, making yourself a priority is just the hardest thing. And learning new habits, right? So I'm midlife now. I'm 55 this month, and trying to teach an old dog new tricks is kind of hard. So I've spent my whole life prioritizing my work, prioritizing my family, prioritizing my children. You know, I have 4 grown, 1 left at home, and the 1 left at home is the one with chronic health issues. So making sure that, you know, she's okay is always my number 1 priority. But I'm grumpy too. Like, Cece, I totally get it.
Man.
You know, and then when I find when I'm doing that, it's because I'm not taking the time and prioritizing myself. And I'm doing things. I'm also looking at making a career change. And so I'm trying to dedicate time to doing that. But that's also a big life change. And so I'm questioning a lot of things, and just, there's just so much. But taking time to actually do something that feels good. You know, I can prioritize the career stuff. I can prioritize the work stuff. I can prioritize the family. But then taking time to say, okay, I'm going to do this just because it feels good for me, and be happy and feel good about it. I'm not quite there yet. So work in progress.
There's like this guilt. We feel like I have to finish everything first before I can. So in my book, one of the major things she said is do what makes you happy first, and then everything else will be easier. It's really hard to do, but the few times I've tried it, my day has went a million times smoother. I can say that it works. So do it first.
Yeah, Cece,
get up and have a luxurious bath.
What book is it that you read? Because I wrote down Fabian. I'm going to read that one too.
It's called, so it has a really weird name, but it's called First Kill All the Marriage Counselors. And it's by It's by Laura Doyle. And I really like the book. So I'm no longer trying to save my marriage.
Mhm.
I'm okay with doing the divorce thing, but I learned a lot about
Yeah.
how to take care of me. And maybe if I ever come to a place where I want to be in a relationship or even relationships with friends, it's helped me with bettering myself so that I can be a better person around others. Because I'm very introverted as well. So I'm not really good with, other people. And it doesn't focus on that at all. It's really good about looking into yourself and habits, changing habits, because according to her, a lot of marriages end because we are taking everything on
Yeah.
ourselves and we don't let our husbands do stuff. And that's probably true, but she focuses on, why do we do that?
Yeah.
Why do you do that? So it's a great listen. It's on Audible.
That is wonderful, Cece. And that leads me, we've got, believe it or not, 5 minutes left. So like
Oh, wow.
my hope, I know. So my hope is that each of us will take 1 minute. Like I want to bring all you guys with me. I want to meet like every week and hear these
I
strong
wish.
ideas. And my email, maybe Monica can put my email up. I'm happy to, talk together, share with you my experience as a woman, and a mother, more so than as a doctor, which I think is kind of boring. Um, yeah, there's my email. Kind of easy, Becky@northstarreach.org. But let's pretend that we each had 1 minute to reach out to each other and the women that we know and care about. Will you get rid of that screen, Monica? So I can see these faces, and could say like one solution-based thing. So like, Cece, you can go again. I'm not taking your turn, but like what you said about putting yourself first. So like, for me, the thing that has made the most difference in my life in the last 10 years where I've really transformed, is I used to live in fear. Like I really did. Fear of financial ruin, fear of something happening to my kids, fear of my daughter who was, out doing things that scared me. And I made a decision with the help of a few carefully chosen supports to live in faith, not fear, and to focus on gratitude and service. So that's not a very practical thing. I guess my practical thing that I would, but those two things, like living in faith and fear and focusing on gratitude and service, have transformed the woman that I am and have helped me, ironically, better be able to take care of myself and take care of others. My one practical solution was I found I have to get outside and exercise every morning. Like I am much better of a human being, physician, friend, mother, if I get out and exercise first. It might only be what I call bookmarking, like just go out, look at the moon, come in. Like I've bookmarked the time and the spot. This is when I'm going to exercise and run a half an hour, like eventually. And now I do. I'm outside every morning for about 20 minutes with my dogs, and that practical thing of starting my day that way, that's really changed, made me a better person, and that little bit of self-care. Who else? You got 1 minute to change our lives.
You're worth it. And just saying that and writing that down and telling yourself that at every
Yeah.
turn, you're worth it.
I was thinking it when you said it.
Oh, good.
Remembering we're worth it.
Yeah.
So what if I don't know how to do that? Tell us how do we start doing that actually, practically?
I think it's scheduling you just taking the moment, and then when you start to think those thoughts that, oh, something else, you just have to bring yourself back to, no, this is mine and I'm worth it, and making that effort and just repeating it until you get it, till it's natural. That's what I'm trying to do.
I'm gonna try.
I'm not there yet, but I'm trying.
Okay.
Yeah.
And I would love it if we could all stay in touch. I think that would be amazing. I was thinking it as we were talking. I'm like, we're all at different phases, different places.
Yeah.
I've been through a divorce myself.
Maybe we could make a Facebook group or something.
I would love that.
That'd be nice. That'd be
Anybody who wants to do that, send me an email and I'll send out a group email and we can figure that out.
Yeah.
Perfect.
That's great, Nicole. Who else?
Me, what I would say is put yourself in your schedule.
Put what?
Yourself in your schedule.
Okay.
Taking care, because what I do is like when I go for my walk, sometimes it depends on the weather. It's like it can be from 7 to 8. And whatever I'm doing in the house, I'm rushing to be done by 7. As if I have an appointment with someone, I gotta go. And when 7 hit the clock, I put my clothes on and everything, I'm out. Don't call me. I'm not gonna do anything for you. Get everything ready. If you need snack before I go, I'll give you snack. Let's rush it because I gotta go.
Okay.
And it's like you make yourself a priority for that. It's the schedule from 7. Sometimes I switch it in